My name is David Backstein. I'm an orthopedic surgeon with a focus in hip and knee replacement. I'm the medical director for HSS at NCH. The patients I see on a daily basis are primarily patients with hip and knee arthritis. They tend to be over 45, 50 years old, with previously active lifestyles a lot of the time, who have developed pain in a joint that's affecting all the sort of activities of daily living, affecting their quality of life, sometimes affecting their ability to sleep at night. The common conditions that I treat are primarily osteoarthritis, so idiopathic osteoarthritis that comes about just because of genetic programming for cartilage to degenerate over time. That's the overall majority of patients. I also see patients with inflammatory arthritis, things like rheumatoid arthritis, post-traumatic arthritis, so injuries when they were younger to bone, to cartilage, to ligaments, that ultimately results in arthritis is called post-traumatic arthritis. I do see a lot of patients who have had hip and knee replacements in the past. Those have either had trouble in the early post-operative period, things like infections or dislocations or instability or malalignment, or they've just simply worn out over time and need to be redone. So a big focus of my practice is the redo of joint replacement. My approach to patient care is, firstly to listen to the patient, find out what it is that's actually bothering them. It's very easy to get focused on x-rays in my line of work and just make diagnoses based on x-rays, but the x-rays don't tell the whole picture. You got to talk to the patient, find out if their primary problem is pain, is it instability, is it affecting their ability to carry out their daily activities, is it, are they noticing a quality of life change for the negative. So getting a full picture of the patient, what their goals are, what their underlying troubles are, is definitely the start. Then I obviously go into the more medical side of things, physical examinations, finding out what exactly is the objective findings, correlating that with imaging, and then coming up with a patient treatment plan. Seeing success in a patient is the best thing that can happen to an orthopedic surgeon, in particular for joint replacement. We're taking patients who are generally not sick. They have a joint that's affecting their quality of life and stopping them from sort of living life to the fullest. So for us, if we can restore their quality of life, it's the best thing we can do. It validates the fact that what we've been doing is the right thing.